I check the physician's orders. I'm knocking. My hands are washed. Hi, my name is Bailey. I'll be your nurse today. Can you tell me your name and date of birth?
Yep, I'm Tanya Poltz and my date of birth is 5/30/70.
Very good. Now I will be gathering my materials to perform my physical head-to-toe assessment. The health history has been taken. All vital signs have been done with height, weight, and BMI, and overall appearance is good of the patient. So can you tell me why you're here today?
I need to get a physical assessment.
Okay, do you know what season of the year it is?
It's spring.
Okay, so speech and communication is good. She shows no signs of slurring of speech. She is alert and oriented ×3. Now can you grip my fingers for me? Now can you push towards me? Okay, so now can you point your feet up and your feet down? Okay, so grips are equal bilaterally, and so is plantar flexion, and that is equal bilaterally. Okay, so now we're going to assess all 12 cranial nerves. Okay, so cranial nerve number 1 is olfactory. Can you just close your eyes for me? Close one nostril, and tell me when you smell this.
Smell.
Okay, now can you do the same with the other nostril? Close your eyes and tell me when you smell it. Smell it?
Yep.
Okay, now we're going to check cranial nerve number 2, the optic nerve. Alright, so pupils are equal, round, and reactive to light accommodation. And now we're going to check the fundus to make sure it is orange. And it is orange. And now we're going to check the other side. And it is orange. Okay, so now I'm going to check cranial nerve 3, ocular motor, cranial nerve 4, trochlear, and cranial nerve number 6, abducens. So can you keep your head straight and just use your eyes to follow my pen?
Okay.
Alright, so all eye movement is within normal limits. Now I'm going to check cranial nerve number 5, trigeminal. So can you close your eyes for me and tell me if this is hard or soft?
That is hard. Oh, that is hard. The other was soft. That's hard. That's soft. That's soft. That's soft.
Okay, so the trigeminal nerve is intact. Now we're going to check cranial nerve number 7, facial. So can you puff your cheeks out, smile, and raise your eyebrows? Alright, so the cranial nerve number 7, facial, is intact. Now we're going to do cranial nerve number 8, vestibulocochlear, or also known as the acoustic nerve. So you're just going to cover your left ear for me and tell me what you hear.
Tanya.
Okay, now can you cover your right ear for me and tell me what you hear?
Bailey.
Alright, so the vestibulocochlear nerve is intact. Now we're going to do cranial nerve number 9, glossopharyngeal. So can you just lift your head up and swallow for me? Alright, so the patient can swallow effectively. Now we're going to do cranial nerve number 10, the vagus nerve. And this is the gag reflex. So can you stick your tongue out and say ah? Alright, so the gag nerve is intact. Now we're going to do cranial nerve number 11. Alright, so I'm just going to put my hands on your shoulders, and can you shrug your shoulders, put them back down, and can you turn your head against my hand? Alright, so the accessory nerve is intact. Now we're going to do cranial nerve number 12, hypoglossal. So can you just stick your tongue out? Open your mouth and stick your tongue out. Alright, so I don't see any deviation to one side of the tongue. Alright, so now I'm going to inspect your head. Do you mind if I touch your head?
No, it's fine.
Do you feel any pain?
Nope.
Alright, so you don't feel any pain, right?
No, I'm good.
Alright, so no lesions, no infestations. I don't see any scars, and you had no pain.
Right.
And now I'm looking at her eyes. Position and alignment is symmetrical bilaterally. Conjunctiva pink and sclera is clear. I don't see any drainage or lesions on the eyelids, and color is normal. Perla, the eyes are pupils are round and reactive to light accommodation. The size of the pupils were 4 millimeters according to my pen light. Her fundus was orange, as we checked that with cranial nerve number 2, the optic nerve. And when's the last time you had an eye exam?
About 2 weeks ago.
Alright, so the Snellen chart is deferred for right now. And I saw no nystagmus, lid lag, or ptosis, And do you wear glasses or contacts?
I wear glasses, but sometimes I wear contacts.
Alright, so the patient wears glasses and sometimes wears contacts. So now I'm gonna check the patient's ears. Do you feel any pain?
No.
No pain? Alright. Alright, so I see normal wax buildup and the tympanic membrane is pearly gray. Now I'm gonna check her other ear. Alright, so there's normal wax buildup and the tympanic membrane is pearly gray on the other side as well.
Is it supposed to be pearly gray?
Yes, the tympanic membrane is supposed to be pearly gray.
Okay.
We already did her whisper test with cranial nerve number 8, the vestibulocochlear. And we already did your sense of smell for your nose, and you don't feel any congestion?
No.
Alright, so do you mind if I can ask you to take off your glasses?
Sure.
And you don't feel any pain?
No.
No congestion or pain?
Mm-mm.
And now I'm just gonna look up your nose, and I don't see any deviation of the septum. Alright, so now I'm just gonna look at the patient's lip. The lip color is pink. I don't see any ulcers, cracks. Moisture looks normal. I don't see any dryness. Can you open your mouth for me? The oral membrane is pink, the teeth are white, and the gums are pink as well. Can you stick your tongue out for me? I don't see any abnormal bumps on the tongue, and her swallowing is normal as we assess that in the cranial nerves. The overall hygiene of the mouth is in good condition. And now I'm just going to inspect the neck. So I'm going to feel your lymph nodes. Do you feel any pain?
No.
Do you feel any pain?
No.
Alright, so in the thyroid there's no pain, and as well with the lymph nodes. So overall appearance of your skin looks good hygiene and it looks normal. Now can you just put your hands out like this? Moisture, texture, and temperature is within normal limits. Capillary refill is less than 3 seconds. I don't see any edema, and your skin turgor is normal, indicating good hydration. I don't see any nail clubbing, no lesions, scars, or abnormalities on the skin. And now I'm just going to feel under your armpits. And I don't feel any lumps. Okay, so now we're going to inspect the respiratory system, and the patient's O2 saturation was at 99%. I'm inspecting her breathing pattern right now along with her respiratory rate. It is symmetrical bilaterally. Do you feel any shortness of breath?
No.
Do you have any coughing?
No.
No sputum or anything?
No.
Alright, no coughing or sputum. And now I'm just going to put my hands on your chest and say 99 every time I put my hands down.
Okay. 99, 99, 99.
Now I'm going to move to your back.
Okay. 99, 99, 99, 99.
And all tactile fremitus is symmetrical bilaterally. Now we're going to do excursion. Alright, so can you just lean forward a little bit for me? And take a deep breath. Alright, so excursion is symmetric bilaterally. Now I'm going to percuss on your front and back. And I should hear resonance in all lung fields. Now I'm going to move to the back. And I heard no dullness in any of the lung fields. Now I'm just going to auscultate all of the lung sounds. Alright, so just take a deep breath every time I place my stethoscope down. Now you can just lean a little bit forward for me. Alright, so I did not hear any adventitious lung sounds such as rhonchi, cracks, or wheezes. Alright, so have you ever smoked before?
No.
You've never smoked?
Nope.
Okay. So now I'm just going to listen to the cardiac system, and first I'm going to auscultate the second left aortic the aortic valve. It's the second left intercostal space. Now I'm going to listen to a pulmonic, the second left intercostal space. Now I'm going to listen to the Erb's point, which is the third left intercostal space. Now I'm going to listen to the tricuspid, which is the fourth left intercostal space. Then I'm going to listen to the mitral, which is the fifth left midclavicular sound. I did not hear any adventitious lung or heart sounds such as S3 or S4, which are murmurs, and everything looks good. So I'm still assessing the cardiac system. I don't see any edema present in the patient. Color and temperature is normal, and cap refill is still under 3 seconds. Alright, so now I'm going to go and feel all the pulses. So I'm going to start with the temporal. The temporal is 2+. I'm going to do carotid one side on each, and they are both 2+. Now I'm going to move to the brachial pulse. They are both 2+. Now I'm going to move down to the radial pulse. They are both 2+. Now can I have you stand up for me?
Mm-hmm.
Now I'm going to feel the femoral pulse. They are both 2+. Now can you turn around? Now I'm going to feel the popliteal pulse. They are both 2+. Now I'm going to feel for the posterior tibialis pulse. They are both 2+. And now I'm going to feel the dorsalis pedis pulses. And they are both 2+. All pulses were expected and none were harsh or faint. Do you have any issues chewing or swallowing?
No.
Do you have a change in your appetite?
No.
Have you experienced any recent indigestion?
No.
How's your fluid intake?
It's good. It's about normal.
Okay, very good. Do you have any recent change in weight loss or weight gain?
No.
Have you ever been constipated the last week or had diarrhea?
No.
Alright, so now we're just going to inspect your abdomen. If you can lay down for me.
Okay.
Alright, so the abdomen is symmetric. And I'm inspecting the abdomen, and then I'm going to listen in all 4 quadrants.
Okay.
So I start with the right lower, then the right upper, then the left upper, and then the left lower. And bowel sounds are normal, or active. And then I would percuss for tympani. And I hear tympani in all 4 quadrants. Then I would palpate. Do you feel any pain?
No.
No pain over here?
No pain.
Alright, so do you have any history of falls?
No.
Alright, so posture, stance, gait, and swing is all normal, and I observed that when we did the height and weight. Now can you stand up for me?
Mm-hmm.
And move your arms like this? Alright, so range of motion in the upper extremities is good. And can you balance on one leg for me?
Yeah.
And then the other one? Alright, so balance is good on the lower extremities. And now can you just bend forward for me, and I'm going to feel her spine. So there's no spine curvature, the spine is straight, no scoliosis, lordosis, or kyphodosis. Muscle tone and strength is 2+, as we observed that earlier with the grips bilaterally and plantar flexion. And now can you just sit down for me, and we're going to do her reflexes.
Okay.
So your upper reflex, right here. Can you put your arm over for me? And one right here. And now we're just going to do the patellar one. And now can you just lay down for me, and we'll do your Babinski reflex. Do you have any sensation of pins and needles?
No.
Alright, and now we're going to do the Babinski.
Alright. Are you doing them on both sides?
Yes. And then I would do the other one, and the reflexes on the other side. And how is your bathing and toileting schedule going?
Good.
Can you dress yourself in the morning?
Yes.
And can you feed yourself?
Yep.
Alright, so all activities of daily living are good. And now we're moving on to genitourinary. Do you have any pain when you urinate?
No.
How often do you urinate?
I'd say 4 times a day, maybe.
Alright, really good. So now we're going to do psychosocial, so the patient lives at home with their family and they're surrounded by their family members. And spiritual and cultural considerations have already been discussed and counseled. And patient education, the patient has been encouraged with an exercise program to maintain their diet and to increase their fluid intake. And is there anything else I can do for you?
No, I think that's pretty much it.
Alright, thank you. And then I would put the bed in the lowest position, give them the call bell, document the care, and tell the patient when I will be back.